If you really want to know why someone close to you died, ask for an autopsy. Homicide detectives use them, and so do doctors, to confirm their diagnoses or to learn from their mistakes. But in recent decades, the autopsy rate in our hospitals has plummeted. They're not cheap. They cost around $2,000, and moreover, they make many families squeamish. But we wondered if there might not be more to it. If autopsies are so indispensable to learning the truth, why are hospitals reluctant to do them? It turns out there may be some things that our hospitals don't want you to know.
About 40% of the time in hospital deaths in America, across the board, the clinical doctor gets the cause of death flagrantly wrong, or there's a serious mistake in what is listed as a cause of death.
40% of them wrong, says Dr. George Lundberg, editor of the Journal of the American Medical Association. Without autopsies, he says, many of these mistakes go unnoticed by hospitals and doctors.
Some doctors, some medical staffs are afraid to find out what happened in people who died.
And a good many of them are burying their mistakes.
In large numbers.
Charles Hamilton might have become one of them had not his family intervened. His wife Beverly was visiting their daughter Tony in Ohio when a hospital back home in Los Angeles called to say that her husband had been in a car accident.
And I said, well, should we be on the plane immediately? And the doctor reassured me several times, he's fine. He came through the surgery fine. Come in a couple of days. He'll be ready to go home by then. He'll be fine.
2 hours later, there was another phone call.
And I heard this horrible scream coming from her office. And I went running in, and then I knew. I said, he's gone, isn't he?
The family rushed back to King Drew Medical Center in Los Angeles, where they learned why a stable patient with a good prognosis would suddenly die. In such cases, an autopsy can often answer that question. But the hospital never offered to do an autopsy, and the Hamiltons grew suspicious when King Medical Center kept insisting that Mr. Hamilton had died from injuries sustained in his car accident.
It was obvious to us, just from their arrogance about the whole thing, that they were trying to keep us from knowing more.
Do you think that the hospital had by this time begun to understand that some negligence had taken place and they were trying to cover it up?
Oh, I think they knew that from the outset.
The Associate Director of Health Services for the LA County Hospital System, which includes King Medical Center, is Dr. Donald Thomas. If you're really bewildered as to how or why this person unexpectedly died,
we would always recommend an autopsy.
You would?
Yes. Doctors by nature are kind of compulsive about certain things, and you want to know what happened to this patient you're taking care of. You don't want to just guess.
Why wasn't an autopsy done on Mr. Hamilton?
His death was not unexpected, nor was it unexplained.
Not true, says Mr. Hamilton's son, Derek.
And so the only way to get us to go away was to come back and say, go ahead and bury him. Never thinking that we would go and have an independent autopsy done.
And that is just what the Hamiltons did. They took Mr. Hamilton's body and hired a private pathologist to perform an independent autopsy. And that pathologist disputed the hospital story that it was the car crash that had killed Mr. Hamilton. Armed with that autopsy, the Hamiltons filed a wrongful death suit, which finally revealed what the hospital had never told them, that Mr. Hamilton had died after an unsupervised first-year surgical intern inserted a catheter near Hamilton's heart, a high-risk procedure that the family's medical experts say was not only dangerous, but unnecessary. King Medical Center, acknowledging the weakness of their case, settled the Hamiltons' lawsuit for $625,000. So had you not gone to the independent pathologist yourself and paid for the autopsy, chances are the hospital would have been permitted to bury its mistake?
Absolutely.
And that was their goal.
When hospitals don't do autopsies, some families turn to this man, Vidal, at 1-800-AUTOPSY. As an autopsy technician, he kept hearing from funeral directors that families wanted autopsies, but that hospitals weren't doing them. So 9 years ago, he started an autopsy business in Los Angeles.
Really, when the families come to us, it's just They need to know what really happened, and if the hospital is not providing this service for them, they come to us. We are really their last alternative.
And the bodies come not just from L.A., but sometimes from other states, even other countries. Last year, Vidal Herrera's staff of doctors did 700 autopsies. Do you advertise?
No.
So it's all word of mouth?
It's all been through word of mouth. We just developed trust.
I know, but to get people to call for your services, they've got to be suspicious.
They're traumatized, they are suspicious, and they're angry. They need to know.
And if there's been malpractice, or if there's been negligence,
we will bring it to their attention.
Out of the cases that come to you, what percentage turn out to be
misdiagnosed?
Yeah.
Approximately 25%.
1 out of 4.
Yes.
I knew they were hiding something, and they were covering something. And I promised my dad I would find out.
Lorraine Russell, Lori Bandow, and Mark Hiffler, each of them, recently used Vidal Herrera's autopsy service to uncover what they say were physician errors that killed a loved one. We asked them whether their doctors had offered an autopsy.
Oh, absolutely not. No.
No, they didn't suggest it.
No, no one would offer that because that's the one place where their mistakes would be brought to the forefront.